First thing that we need to look at are obviously these quadriceps. They get a lot of work over and over and over pedaling. So we're just going to come down, apply some flat pressure onto these tissues. These muscles can also become, you have 4 muscles that attach onto your, form your quadriceps, and they can become adhered to each other as well as to this iliotibial band. So first we just want to loosen those tissues. And then we're going to look for a little separation. So I'm going to take this top quadricep muscle and just kind of try to pull it off those other tissues. Try not to tickle you. Once we do that, and I'm starting to get a little separation there, we can also take this bottom muscle, kind of shift it off to the side, and follow up and see if we find any adhesions in those tissues. Now, another common thing that happens with repetitive bicycling is that this iliotibial band starts to get adhered to the vastus lateralis. And what we're going to do now is we're just going to attempt to separate that tissue. So what I'm going to have you do, Julie, I'm going to roll your leg in and lock into that tissue. This is called a log roll. And what you're going to do is gently roll your leg into my hand. So you're going to push against the direction that I'm taking you. And we're going to hold that for a count of 6-7 seconds and relax. And now I'm going to take and pull that vastus lateralis off of the IT band. Now we're going to go one section up. You're going to roll your leg out into my hand and relax and rolling. I also notice I've got my hand on her thigh as well. So as this hand moves forward, this hand is moving back, and we'll actually get down all the way. We'll be affecting the bone and all the attachments on the bone, because we're taking this whole compartment and rolling it off. The only contraindication for this, most people are laterally dominant. If you've got somebody that is pigeon-toed, we don't want to be doing a lot of myofascial work encouraging the pigeon-toedness, but 8 out of 10 times, 9 out of 10 times, you'll see this as the dominant pattern. So we're going to do that one more section. Coming up, my hand is just off of the IT band, right where the lateral quadricep is. So I'm going to come, I'm going to roll, I'm going to have you contract one more time and relax, and now more rolling. So now that we've treated the iliacus and the quadriceps, we're going to look at the psoas. Psoas attaches anteriorly on the spine, comes down, crosses the inguinal ligament here, and then attaches deep in the inner thigh at the lesser trochanter. I've treated the psoas directly in the past. However, there's a bunch of viscera and organs here, so I've started to, instead of going in and doing a lot of direct pressure into the psoas, instead we're going to do a little myofascial release. And where I'm going to anchor is right here, so that this is the inguinal ligament from here to your sacrum. I'm just above it here, and then I'm going to come just to the other side of it here, and I'm going to gently spread. So what this is going to do is it's going to release any myofascial impingements for the psoas. Generally, it will do the job. We can do a little muscle testing with it just to make sure that it's firing properly, but 9 times out of 10, this combined with some light stretching will be effective with the psoas. And there isn't a whole lot to show with this because I'm just locking into the tissue and opening it up. And what you'll feel is if I've got my hands here, that they're just going to gently open up and move gradually. Usually you'll be in that position for 30-45 seconds before you start to feel a shift in the tissue as this opens up. All right, let's go ahead and have you turn over, and we're going to stretch out the quadriceps and the psoas and the anterior hip capsule. So now that we've released the quadriceps and psoas and iliacus, we're going to do some stretching. The reason that it's important to stretch is if you think about being in a bicycle and you're in this position and then you're constantly asking all of this to work over and over again, we need to get some length through the quads, through the psoas, and that's what this is going to do. So a traditional stretch is just coming in and pushing until you hit that resistance and then holding. A much more effective technique is muscle energy techniques. And so what that involves is we're going to come up, there's the motion barrier. Now I'm going to have her contract into my hand. So push into my hand. She's going to do that with about 20% of her effort for about a count of 5 and relax. And now we're going to go to the next motion barrier. There we go. And contract again. 1, 2, 3, 4, 5 and relax. Coming to the next motion barrier. And let's do that one more time. And 1, 2, 3, 4, 5 and relax. Good. So we have her just about to her butt. Let's see if we can do it one more time. And contract and relax. And this is going to feel really good with your people that are going out and doing 40 miles on the weekend on their bike. All right, so now that we've gotten this quadricep opened up, we're going to look at the anterior hip capsule. And you can have problems there from being in that shortened position over and over again. So I'm going to come, grab her knee here. I'm going to put my hand with some downward pressure into this anterior hip capsule. And I'm just going to open and close that. Just get a nice stretch into that hip capsule. Good. From there, we want to stretch out the psoas. What's important with this is I'm going to put my hand on her sacrum, and I'm not going to allow it to move all the way up, so then we would be like torquing the lumbar spine. We're just going to hold there, and I'm just going to now move up until I feel that motion barrier into my hand. As the sacrum starts to want to move, that's my end point. Good. Now the other common issue that happens with bicyclists, besides these tight quadriceps that then pull onto the knee and can create knee problems, and being bent over all the time and activating your psoas, which can create lumbar problems, is looking at the neck. And we're going to do a moment or two on that. The reason for that is if you think about being bent over and then tilting your head up for prolonged periods of time, that can create a lot of strain in your upper cervicals and can create headaches and can create all sorts of other issues. So we want to make sure that we get some length through those cervicals. So we just did work on the anterior hip flexors. The importance of that is because bicycling, if you're spending hours and hours opening and closing your hip flexors here, they can get real tight. But the other thing that often happens is if you're spending lots of time bent over and then you have to look up to the horizon, these muscles, these suboccipitals and upper neck can become irritated, can lead to headaches. So we're going to do a couple of techniques to get these vertebrae to open up. So first thing we're going to do is just a very light traction. I'm going to feel the tissues. And now what I'm going to do is tilt the chin down. So there's C1, C2 up here. If they're constantly here, we want to get them open. And if you notice, when I open it, my chin comes down. So we're going to just feel for that range of motion there. I'm going to do a little rotation. This shouldn't hurt. If it does hurt, let me know. And just opening up those tissues. Good. Now, we don't want to do a lot of digging directly into the suboccipitals because you've got nerves. We can do more harm than good. But what we can do is come up onto the occipital ridge. That's where all these little muscles are attaching, and do some light release there. So again, I'm actually on the skull. I'm not digging underneath the skull. It sometimes feels good, but there's too much important stuff underneath there to really go digging. Good. And coming to the other side. Now we're going to do a little muscle energy technique and stretch out her neck. Again, bicyclists often get into this excessive lordotic curve through their neck and put a lot of pressure on the suboccipitals. So what we're going to do is we're going to bring the head up and brace. And now with 20% of your effort, push back onto the table. And relax, a little stretch, and again. Relax and stretch. Good. Same thing to the other side. What's important when you're doing these, one of the things that's important when you're doing these muscle energy techniques is don't take it all the way up to the very end range before you start doing the contraction. Move slowly into it. You'll feel a motion barrier. I could go another ½ an inch, but I'm going to the first motion barrier. I'm having her contract into my hand. Go ahead and contract. And relax. And next stretch. And one more time. 2, 3, 4, 5, 6. Relax. And stretch. All right. Well, my name is Greg Gorey. Glad you joined us. The links are down below. Check us out, hillsfitness.com, and see you next time.